All right, let's get straight to it. There's a core principle that anyone in the regulatory world lives by, the one that keeps us up at night. You just can't regulate what you can't see. Simple as that. It's the fundamental failure behind every single crisis. And today, we're taking a hard look. We're auditing a system that makes a bold claim that it can finally turn the lights on.
And this right here, this isn't some made-up scenario. This is what we face every single day. A shipment leaves a port, it's got all the paperwork. Documented, cleared, stamped, approved. Looks perfect on paper. But that paper trail can be a complete ghost, a forgery hiding something deadly. The system as it stands, well, it's practically begging to be gamed. And believe me, it is being gamed at an enormous scale. So here's the real heart of the issue, the main point of our audit today. The people doing this, they're not always master criminals with some super sophisticated tech. Nope. The real problem is our own systems. They're fragmented, they don't talk to each other, and most importantly, they have no memory. No single reliable source of truth. And it's in that gap, that systemic amnesia, that counterfeiters don't just survive, they thrive.
Now, before we dig into the tech and the details of the proposed solution, let's be crystal clear about what's at stake here. This isn't just about closing some administrative loophole or fixing a bit of red tape. No, this is about life and death. And the numbers, well, they're nothing short of horrifying.
Look at this statistic from the World Health Organization. It's staggering. 1 in 10, 1 out of every 10 medicines in low and middle income countries is either substandard or just a flat-out fake. Just let that sink in for a second. That's a 10% chance that the medicine you're given, an antibiotic, an anti-malarial, is not what it claims to be. A 1 in 10 chance.
And here's the direct result of that, the tragic human cost. We're talking about more than 170,000 children gone every single year. And that's from just 2 types of falsified medicines, for pneumonia and malaria. These aren't just statistics, right? These are preventable deaths, deaths caused by a system that's flying blind.
On top of the human tragedy, this is also a massive criminal business. $200 billion a year. That's the scale of the counterfeit drug trade. In some places, it's actually more profitable than drug trafficking. And why? It's simple, really. The risk of getting caught is incredibly low because we, the regulators, are effectively blind. Okay, so let's put on our regulator hats and really diagnose this thing. What are the specific cracks in the system that let this happen? Where are the gaps in our audit trail? Honestly, it's a total breakdown of data integrity. There's no unified digital tracking across borders. Our own regulatory systems, they don't talk to each other. We're still relying on paper documents, which are so easy to forge, as our source of truth. The informal market, it's a complete black hole. And our surveillance, it's all reactive. It only starts after someone's already been hurt. We don't even have a shared data standard, a common language for this stuff across the continent. Every single one of these points, it's a huge gaping vulnerability. You know, when you lay out all these failures, one after another, the outcome isn't just predictable, it's inevitable. We lose control, the public loses trust, and worst of all, people lose their lives. It's a devastating but predictable result. Okay, so we've laid out the problem in pretty stark terms. Now let's get to the solution, or at least the proposed one. We're here to audit the AfriPharm Health system. And I want to be really clear about this. This isn't some theoretical white paper or a small pilot study. This is infrastructure that's already deployed and operational. So let's pop the hood and see how it's built. The whole system is built on 4 layers. They're distinct, but they're all integrated, and each one is designed to plug one of the specific holes we just talked about. We're going to go through them one by one. The blockchain backbone, the PPN enforcement engine, the FHR demand control, and the patient truth layer. So, layer 1, the foundation of everything, is a blockchain backbone built on something called Hyperledger Fabric. Now, the key word here for us as regulators is permissioned. That means only verified, trusted players, think manufacturers, distributors, and yes, us, can actually write data to this ledger. What you get is a single, tamper-proof record of a medicine's entire journey. It's permanent. It can't be changed. It can't be deleted. So, if I'm running through my audit checklist for this layer, what do I see? Check 1. An unbroken, unchangeable chain of custody. Check 2, real-time location at every single handoff. Check 3, a fake entry can't be forced onto the chain. It just gets rejected. And here's the kicker.
If someone tries to inject a counterfeit product into the supply chain, it creates a break, a digital red flag that is instantly visible to every regulator on the network. Suddenly, that silent substitution we worry about, it's no longer silent. In fact, it's impossible.
Okay, great. So now we have this single source of truth locked on the blockchain. But how do you enforce that truth in the real world, at the pharmacy counter? That brings us to layer 2, the Pharmacy Partner Network, or PPN. Think of it as the system's enforcement engine. Only authenticated, pre-vetted pharmacies can even join the network. And once they're in, they can only dispense medicines that have been verified on that blockchain.
And this is a really fundamental shift in how we think about regulation. We're moving away from chasing bad guys after the damage is done. Instead, compliance is built right into the system from the very beginning. It's not reactive policing anymore, it's automated prevention. If you're not a verified pharmacy with a verified product, you just can't make a transaction. The system itself becomes the enforcer.
Now, securing the supply chain is a huge piece of the puzzle, but it's only half of it. We've also got rampant fraud on the demand side. I'm talking fake prescriptions, overprescribing, patients getting the same script filled at 5 different pharmacies. So Layer 3 tackles this head-on. It digitizes every prescription using an international standard called FHIR. And what this does is create a secure, verifiable link between the doctor, the patient, and the medicine. And for us, as regulators, this means we suddenly have total visibility. Every single prescription is digitally tied to a licensed prescriber. The system automatically flags things like duplicate dispensing. For any kind of national health insurance or universal healthcare program, this is a total game changer. It's designed to structurally eliminate reimbursement fraud right at the source. All right, that brings us to the 4th and final layer. And this one is all about closing the loop and bringing the patient into the picture. It combines a health vault, which is a secure place for a patient's own health records, with an AI companion. This tool actually empowers the patient to verify the medicine in their hand and to report any concerns directly back into the system. And what this does, and this is so important, is it transforms patients from being passive victims into an active part of the solution. They become the last line of verification. We're essentially creating a continent-wide surveillance network, our eyes and ears on the ground, giving us real-time data we could never hope to collect otherwise. So let's pull back and look at the whole picture. When you stack these 4 layers together, how does it actually change the game for regulators? Well, it shifts our entire posture. We move from being reactive, always cleaning up yesterday's mess, to being preventive and stopping tomorrow's crisis before it can even start. This table really brings it all home. Think about all those gaps we identified at the beginning. No traceability. The blockchain solves that. Unverified distributors, the PPN locks them out. Prescription fraud, the FHIR layer makes it impossible. Patients left in the dark, the health vault empowers them. It's a direct one-to-one mapping of problem to solution. The things that were invisible are suddenly visible. And this might be the single most important takeaway from this whole audit. As nations move towards universal health coverage and expand access to care, if we build that on top of the broken, blind systems we have now, we're not increasing safety. We're actually multiplying the risk. We're just creating a bigger market for counterfeiters. The infrastructure, this digital foundation, it has to come first. It can't be an afterthought. Remember where we started with the simple idea that a system with no memory can't be controlled? Well, the entire point of this 4-layer infrastructure, from the deep-level blockchain right up to the app on a patient's phone, is to do one thing: give the healthcare system its memory back. A perfect, permanent, and verifiable memory. Which brings us to one last big question, because this is about so much more than just stopping fake drugs. If you can give the system a perfect, verifiable memory, if you have a trusted, real-time data layer for an entire continent's healthcare, what else does that make possible? Think about it. Pandemic response, smarter resource allocation, better clinical trials, public health policy based on actual real-time data. Solving this one foundational problem of sight and memory, well, it doesn't just fix what's broken today. It unlocks an entirely new future.